Did you know that some doctors in the United States earn over $700,000 per year? But those massive salaries don't come easy. Most of these specialties require over a decade of training, intense residency programs, and long hours. In this video, we're counting down the 10 highest paying doctor specialties in 2026. Let's start with number 10. Anesthesiology, with about $523,277 per year. Anesthesiologists are responsible for managing pain and anesthesia during surgeries. They make sure patients stay unconscious during procedures and carefully monitor their vital signs like heart rate, blood pressure, and oxygen levels. To be an anesthesiologist, you need to complete 4 years of undergrad, 4 years of med school, and 4 years of anesthesiology residency. This means we're talking about around 12 years of total training. As far as the lifestyle goes, anesthesiology often has a more predictable schedule compared to many surgical fields, but it can still include early mornings, long operations, and emergency surgeries. At number 9, gastroenterology, with an average salary of about $537,870 per year. Gastroenterologists specialize in the digestive system. They diagnose and treat conditions affecting the stomach, intestines, liver, and pancreas. They also perform procedures like colonoscopies and endoscopies to detect diseases such as colon cancer. For this specialty, you need 4 years of undergrad, 4 years of med school, 3 years of internal medicine residency, and 3 years of gastroenterology fellowship. This means that there's around 14 years of total training. The lifestyle for this specialty is pretty good because many procedures are scheduled in advance. At number 8, we have urology, with an average salary of about $559,474 per year. Urologists treat conditions involving the urinary tract and the male reproductive system. This specialty combines surgery with outpatient clinic work, so urologists split their time between the operating room and seeing patients. For education, you need 4 years of undergrad, 4 years of med school, and 5 to 6 years of urology residency. This means about 13 to 14 years. Urology has a moderate work-life balance because surgical days can be long, but many urologists have fairly stable schedules. At number 7, we have radiology with about $571,749 per year. Radiologists specialize in medical imaging. They analyze scans like X-rays, MRIs, and CT scans. These images help doctors diagnose everything from broken bones to cancer. Some radiologists also work in interventional radiology, where they perform minimally invasive procedures using imaging technology. For this specialty, you need 4 years of undergrad, 4 years of med school, and 5 years of residency, which totals to about 13 years of education. As far as the work-life balance goes, radiology is often considered one of the better lifestyles in medicine, especially with remote or teleradiology jobs becoming more common. At number 6 is vascular surgery, with an average salary of about $576,452 per year. Vascular surgeons treat diseases of the blood vessels and circulatory system. They perform procedures to repair arteries and veins, treat aneurysms, and restore blood flow to different parts of the body. Because vascular disease is common in aging populations, this specialty is in high demand. To be a vascular surgeon, you need to complete 4 years of undergrad, 4 years of med school, 5 years of general surgery residency, and 2 years of vascular surgery fellowship. This totals to about 15 years of training. This specialty is really demanding because vascular surgeons deal with emergency surgeries and long operating hours. At number 5 is cardiology, with a salary of $587,360 per year. Cardiologists specialize in heart and cardiovascular diseases. They treat conditions like heart attacks, heart failure, high blood pressure, and blocked arteries. Some cardiologists also perform life-saving procedures like placing stents in arteries. To be a cardiologist, you need 4 years of undergrad, 4 years of med school, 3 years of internal medicine residency, and 3 years of cardiology fellowship. All of this comes to about 14 years of training. This branch is also often demanding because of its interventional cardiologists who handle emergency heart procedures. At number 4 is plastic surgery with about $624,445 per year. Plastic surgeons perform both reconstructive and cosmetic surgery. Examples include repairing injuries after accidents, correcting birth defects, and cosmetic procedures like rhinoplasty and facelifts. Some cosmetic plastic surgeons run private practices, which can significantly increase income. To be a plastic surgeon, you need 4 years of undergrad, 4 years of med school, and 6 years of plastic surgery residency, which comes to about 14 years in total. This is one of those specialties where it's hard to say the lifestyle because cosmetic surgeons often have more control over their schedules than hospital-based surgeons. Now at number 3, we have orthopedic surgery, with an average salary of about $679,517 per year. Orthopedic surgeons specialize in the musculoskeletal system, including bones, joints, ligaments, and muscles. They perform surgeries like joint replacements, ligament repairs, spine surgery, and sports injury treatment. To be an orthopedic surgeon, you need 4 years of undergrad, 4 years of medical school, and 5 years of orthopedic surgery residency. This totals to about 13 years. This branch is busy and physically demanding, but extremely rewarding financially. At number 2, we have thoracic surgery, with an average salary of about $689,969 per year. Thoracic surgeons operate on organs inside the chest, including the heart and lungs. Common procedures include lung cancer surgery, heart surgeries, and chest trauma repair. Because these surgeries are extremely complex and high risk, thoracic surgeons are among the highest paid specialists in medicine. The education for this specialty requires 4 years of undergrad, 4 years of med school, 5 years of general surgery residency, and 2 to 3 years of thoracic surgery fellowship, which comes to about 15 plus years. This branch is very demanding with long hours and high-stress operations. Last but not least, at number 1, we have neurosurgery, with an average salary of $749,140 per year. Neurosurgeons are the highest paid doctors in the U.S. They perform surgery on the brain, spinal cord, and nervous system. These surgeries can include removing brain tumors, repairing spinal injuries, or treating aneurysms. Because the brain controls the entire body, neurosurgery is one of the most complex and risky specialties in medicine. To be a neurologist, you need 4 years of undergrad, 4 years of med school, and 7 years of neurosurgery residency, which totals to about 15 to 16 years of training. This is an extremely demanding field with long hours and life-or-death emergencies, but it also comes with the highest salaries in the medical field. So those were the 10 highest-paying doctor specialties in 2026. But while salary is important, choosing a medical specialty should also depend on your interests, lifestyle goals, and passion for helping patients. If you enjoyed this video, make sure to like and subscribe for more medicine-related content.